Today I'll be doing an evaluation on a 15-year-old male who came in for a head, face, neck, eyes, ears, nose, throat, and mouth evaluation. Denies any tenderness to head upon palpation. His hair is light brown, thick, clean and dry, clean and clear. His scalp is clean and clear, no dandruff, lesions, or infestations noted. His face is nice and symmetrical. No thrills felt on palpation of temporal arteries. Cranial nerves number 5 and number 7 are intact. No denies any tenderness of frontal and maxillary sinuses. Then we moved on to his eyes, external structures. No drainage noted, and his eyelashes and eyebrows were brown in color. No redness or drainage noticed to the eyes. The conjunctiva was nice, pink and moist. Sclera nice and white. Iris is nice, clear and blue. Cranial nerve number 2 was intact. Cranial nerves number 3, 4, and 6 were intact as well. Corneas were nice and round. Pupils were equal, round, and reactive to light and accommodation. His nose was nice and symmetrical. No drainage or sores noted. His nasal mucosa was nice, red and moist. His septum was nice and midline. Cranial nerve number 1 was intact. And no lesions or sores noted to the inside of his nose. Moved on to his ears. His ear, he denies any tenderness. Cranial nerve number 8 was intact. And his ears were nice and symmetrical. No drainage noticed to either ear. Moved on to his mouth. His lips were pink and moist. No drying or cracking of the lips. No cold sores or lesions noted. His buccal mucosa, his tongue, his soft palate, his hard palate, and his tonsils were all nice, pink and moist. Tonsils were nice and round. Tongue was nice and smooth. No dental caries noticed. He does have dental braces on both tops and bottoms. Check the inside of his lips for any lesions from rubbing of the braces. There was none noted. Checked cranial nerves number 9, 10, and 12. All were intact. Moved on to the neck. All cervical lymph nodes were palpable, and he denies any tenderness. His trachea was midline. We did a thyroid exam. He denies any tenderness, and there was no enlargement noticed. And that concludes my assessment for the 15-year-old male.